attention to rising fertility trouble in our nation and remove the barriers and stigma surrounding it. KCTV 5's Carolyn Long introduces us to a Metro doctor to explain the CDC's newly released infertility statistics.
Dr. Weaver, thank you so much for joining us. I think many people would be astounded at these staggering new numbers out.
About 10 to 15% of couples in the United States do experience some form of infertility during their reproductive lives.
That's why Dr. Kristi Weaver, an OB/GYN at Overland Park Regional Medical Center with HCA Midwest Health, is here to spread the word that it is common and nothing to be ashamed of. Let's take the stigma away. I agree with you on
Exactly.
that. For sure.
Exactly.
But what do you attribute these high numbers to?
So we have women that are trying for pregnancy at much later in life these days. Many women want to explore their careers or explore travel prior to settling down and starting a family. So certainly age is one factor. We have many multiple comorbidity conditions here in this country. Things like diabetes and hypertension that can make it difficult for couples to get pregnant. And that goes for our male partners as well, not just the women.
Very interesting. Okay, so what can be done? I think when people finally get to your office and they're at their wits' end, we've been trying, nothing's happening. What are the options out there now for these couples?
So I think the first thing I want to say is don't get to your wits' end. Come in. I have identified some of the simplest problems in terms of why couples aren't able to get pregnant.
How many months of trying would you give it before we make a phone call?
The definition of infertility is inability to achieve pregnancy after 1 year of trying.
1 year.
So if you are a woman in her 20s or early 30s, I would say that definition of infertility is about 1 year. That doesn't mean you have to wait. If you've been having trouble after 6 months, that is a perfectly reasonable time to call your doctor.
And with more couples growing their families later in life, the egg banking fertility service is booming.
The best time to do this is during a woman's most fertile part of her life, which is in her 20s. So this is not a process for everyone, and I certainly don't want to bring this up and make women feel pressure that they need to do this. But if you are in your late 20s or early 30s and you know for sure that it is going to be a decade or more before you are ready to start a family, this would be a process that we would want you to look into.
Dr. Weaver, thank you so much for joining us. Let's normalize the conversation.
Thank you for having me, Karen.
For more from HCA Midwest Health, you can go to kctv5.com and click It's Your Health.